Well, as the WHO urges countries to step up testing their citizens for coronavirus, the UK government appears to be adopting a different approach. Yesterday, it said it would only test people in hospital for COVID-19 rather than those with suspected cases at home. Now we've been speaking exclusively to a British company which says it has developed a rapid testing kit. The company says results can be obtained in around 10 minutes. NHS testing takes much longer. They're shipping the kits to pharmacies in the UK next week and hope to eventually distribute them to the wider public. Well, Victoria MacDonald is in Belfast for us tonight. Victoria.
Yes, well, you heard Fatima there talking about concerns, questions over whether the UK government has actually gone far enough. For instance, they didn't talk at all last night about social isolation. And what we are seeing now is people taking things into their own hands. We've heard of nursing homes that are closing, wanting to protect their residents, telling visitors not to come. We've heard of, as you said, sporting fixtures, the Premier League and the London Marathon. There is a real sense of fear growing actually in the community, and that's where this kit comes in that you mentioned, a new potential testing kit that we could use to determine whether we have coronavirus. Those boxes on the right are packed and ready to be sent to Bahrain today. Inside are this company's first ever shipment of a 10-minute self-testing kit for COVID-19. From next week, they'll be sent around the UK in what is believed to be the first rapid test available in this country.
If you have symptoms first, that's the important thing. You should ideally wait 3 days from when you first got symptoms to when you carry out the test. If that comes up negative, it is still possible that your body hasn't produced enough antibodies yet that can be detected. So in that case, you're best to wait and further 2 to 3 days and repeat the test. If you're still negative, then it is likely that you don't have the coronavirus. It's perhaps you have the flu or the common cold or some other related illness.
Channel 4 News was given exclusive access as this company prepared these highly sought-after diagnostic parcels. Even as we were there, the phone was ringing off the hook. We can't say, though, where we are. They are deeply worried that the public will come knocking on the door asking for the kits. Yet for the moment, they can only be used by healthcare professionals. The first distribution will be to pharmacists to test their staff.
We are working with the manufacturer partner of ours to credit the test and get a notifiable body to give the necessary certification so that we can provide it to the public, again through the pharmacy channel, so making the tests available to be sold in pharmacies, either online pharmacies through all our partners, all our customers, all our pharmacy customers.
It is hoped they will have the go-ahead to make this testing kit available to the public within the next 3 weeks. The NHS test is a swab to detect the virus itself, whereas this test is to see if you have produced antibodies to the virus that causes COVID-19. It is simple to use.
I'm going to take a finger prick blood sample and I'm going to add it to the test cassette, and then I will add some buffer, and that will help the blood sample flow along the strip, and then we will check to see whether you have a positive or negative result.
Beneath my calm exterior, of course, I was nervous. We have been told this virus is spreading across the country and that there may be between 5,000 and 10,000 cases. Today alone saw a jump of more than 200.
People who are who are remaining at home do not need testing, and we will pivot all of the testing capacity to identifying people in hospitals who have got symptoms.
The announcement made yesterday leaves question marks over the use of testing stations like this one at Craigavon Area Hospital in Northern Ireland.
So we'll probably be able to repurpose the pod for some other activity related to COVID.
Like what?
Well, for example, we're very keen to try and make sure that patients with COVID don't come into contact with patients who don't have COVID in our emergency departments.
What is not clear is how the government will now know the true level of COVID-19 in the population, but it is likely that this gap will mean some people will now want to test themselves. For the moment, though, it will be in the hands of pharmacists, who are worried about protecting their own staff as increasing numbers of patients turn to them for advice.
We intend to stay open to the public to provide services in a safe and effective way. Obviously, medicine supply to patients is our priority, and we need to make sure we do that safely, but patients equally, to ensure that we can stay open, need to abide by those recommendations and not come to their pharmacy if they feel that they're in any way affected with COVID-19.
There are at least 15 rapid self-testing kits like this one being evaluated by Public Health England. They want, of course, assurance of their accuracy. And this company does say any positive results should be followed up with an NHS test. So the 10 minutes up, and I was allowed a look. Was I infected or not?
Which means that you do not have antibodies in your blood specific for this coronavirus.
Oh, so I don't have coronavirus. Good.
Not yet.
Not yet. Yes, well, you can imagine I was quite relieved about that, but the fact is that many of us are going to contract COVID-19. And today we've heard about more and more hospitals who are closing off wards, preparing to receive numbers of patients. In fact, here in Northern Ireland, the Health Minister warned that health services would be significantly curtailed, he said. We got a similar message from Wales, also non-urgent outpatient day cases being cancelled, inpatient cases and diagnostics. And as I said, hospitals closing off wards, but we're also hearing about staff who are concerned about having the right equipment and the right protection and worrying that they're not being trained yet enough to protect themselves against what is coming.